Let's race through a question here. Really high yield. I've made questions like this in the past. Let's hope that you guys can get this question correct. A 72-year-old man brought to the ED after a witnessed seizure. He has no prior history of seizures, so now you're thinking what might have caused this one. His family reports progressive confusion, headaches, and difficulty walking over the past 3 weeks. His only medication is warfarin, and his current vitals are stable. CT scan shows a crescent-shaped hyperdensity over the right cerebral hemisphere. What is the most likely diagnosis? Alright, so we need to be thinking here is a subdural hematoma. Okay, we've made these questions like this in the past. It's so high yield, comes up in every single exam, okay? So this is due to tearing of bridging veins, especially in elderly or those taking warfarin, so any anticoagulants. Obviously that allows you to bleed more. So warfarin is a risk factor for getting some type of bleed, and so that can happen for brain bleeds as well. So you're going to have slow venous bleeding that's going to progressively grow and progress, and that can lead to headache, confusion, gait instability, seizures over days to weeks, and that's how it can present. And it shows a crescent-shaped hyperdensity that can cross suture lines. So memorize that, understand that, know that for your exams. To go over the other topics, all right? Epidural hematoma, option A, is the wrong answer. So this is going to be rupture of middle meningeal artery. Remember, that's a branch from the maxillary artery, and that can happen after trauma. Classically presents with a loosened interval, then rapid deterioration. CT will show a bioconvex hyperdensity that classically does not cross suture lines. So that's the difference there. Subarachnoid hemorrhage, option B, is going to be the sudden worst headache of your life. They're not always going to say that anymore, but it's going to be photophobia, nuchal rigidity, things like that. And it can be due to a ruptured barrianeurysm. So remember, with polycystic kidney disease, can have a link with a barrianeurysm. If that ruptures, you can get a subarachnoid hemorrhage. Okay. Last option, intercerebral hemorrhage. This might be a focal neurological deficit or headache, and it's going to be in patients that have chronic hypertension. And the CT scan, remember that, always remember that you are going to do a non-contrast CT if you're suspecting a brain bleed. Remember, contrast will show up the same as blood, so you want to make sure that it's a non-contrast CT. And for intracerebral hemorrhage, you're going to have hyperdensity within brain parenchyma, not over the hemisphere. Okay, so remember that. Make sure you remember everything about subdural versus epidural hematomas, and have that memorized and understood. And if you like this content and you like these type of questions, give us a follow, like, and share with your friends. Cheers.